Hello everyone. In this video, we are presenting on the topic role of probiotics in the health of aging population. We are going to give you an idea about the health benefits of probiotics, mainly focusing on the elderly population. So, to begin with the relevance.
The major share in Canadian population is of people aged 65 and above, and the study shows that in coming years, the proportion of elderly people will rise again. So people have many concerns about taking medications. Most of them are not willing to undergo any medication. Here comes the importance of foods with functional properties and therapeutic values. This statistics shows that the US probiotic market size by products. From this bar diagram, it is clear that the consumption of probiotics food, beverages, and diet supplements is increasing every year. In this presentation, we will discuss the importance of this trend.
So, what are probiotics? Probiotics are live microorganisms that, when administered in adequate amounts, confer a healthy benefit on the host. Probiotic food are food which contain at least 10 raised to 7 to 10 raised to 8 viable bacteria per gram at time of manufacture. Some of the probiotic foods are Yakult, lassi, kefir, yogurt, Setgut. Compared to medications, probiotic foods provide nutrition with no side effects. Wide range of health benefits for a longer period are offered by probiotic foods. It is even good for the overall health. So here are some of the claimed and proven benefits of probiotics. Gastrointestinal health, established balanced gut microflora, improved nutrition intake and vitamin synthesis, improved immunity and metabolic activities, helps to prevent colon cancer. Some other benefits of probiotics are it helps with the liver diseases, irritable bowel syndrome, constipation, antibiotic associated diarrhea, Clostridium difficile infections or CDI. And the list continues.
Unlike other microorganisms, probiotics have the capacity to survive in the intestine by resisting the bile and gastric juices. It can proliferate in the intestine and can bring down the number of harmful gut microflora. Probiotic strains thus improve the gut health. It can also improve the absorption of nutrients and synthesis of vitamins, and it can also improve the digestive capacity. Probiotics helps with CDI infection, which is caused by antibiotic consumption that affect the normal colon bacteria. The symptoms vary from mild diarrhea to severe colon inflammation. Combination of probiotic strains of Lactobacillus acidophilus, Lactobacillus casei, and Lactobacillus rhamnosus have a moderate effect in preventing primary CDI. One of the major diseases that can affect the health of elderly people in Canada is colon cancer. Probiotics can play a role in preventing colon cancer by binding and degradation of potential carcinogens by producing anti-mutagenic compounds, enhancing host immune response, and altering physicochemical condition of the colon.
Elderly people tends to take more medications which increases their chance for antibiotic associated diarrhea, which causes them to pass loose watery stools 3 or more times a day. Antibiotic intake will kill both pathogenic and healthy bacteria in the gut and also lead to a condition of diarrhea. Probiotic helps in the growth of healthy beneficial bacteria and improve gut health. Irritable bowel syndrome is a common disorder that affects the large intestine with symptoms that includes cramping, abdominal pain, bloating, gas, diarrhea, or constipation. Probiotics can help to alleviate the symptoms and can decrease the abdominal pain associated with it.
The functionality of probiotic is generally dependent on specific strains. The commonly used strains in probiotic foods are Lactobacillus acidophilus, Lactobacillus plantarum, Lactobacillus rhamnosum, and some Bifidobacterium and Streptococcus strains. Probiotics are available in the form of supplements, yogurt, fermented beverages, fermented rice, etc. in the market. Here are some of the probiotic foods that are commonly available in the market.
Probiotic bacteria helps to slow down the immune decline, support the immune function. Probiotic bacteria and their cell wall components, DNA, and metabolites have immunomodulatory properties. A wide range of benefits of probiotic bacteria on immune system function have been studied. The species Lactobacillus acidophilus, Lactobacillus casei, Plantarum delbrueckii, rhamnosus stimulate immune system. Diverticular disease is the presence of diverticula in the absence of complications such as fistula, perforation, obstruction, or bleeding. So probiotics can reestablish the physiological bacterial flora, which in the presence of diverticular disease may be altered by the reduced colonic transit time and stasis of fecal material within the diverticula.
People with lactose intolerance can consume probiotic dairy fermented foods, since lactose will be hydrolyzed by lactic acid bacteria to glucose and galactose. These can supply nutrients needed for the elderly people, especially calcium, which strengthens their bone. Probiotic supplements with probiotic bacteria in freeze-dried form is more effective than probiotic foods. It have more shelf life than probiotic food. Other benefits of probiotics include it can reduce the symptoms of ulcerative colitis, Crohn's disease, pouch disease, and celiac disease.
Probiotics has many proven and claimed health benefits in elderly. Probiotic food is not a medicine on the other hand, it is a functional food which can bring some health benefits. Normally, there is no harm in taking probiotics along with other medications. To maintain the health and decrease the age-related symptoms in elderly people, it is always better to consume foods with functional and health benefits without any side effects. It can improve their digestion as well as immunity. Frequent and periodical consumption shows greater result.